All right. Hello again, everybody. Welcome back to Diabetes University. I am your host for this adventure. My name is John Bredenberg. For those of you that are brand new to our program, welcome. And to those of you that were here last month, welcome back. As you know, each month we try to gather virtually and discuss issues specific to the management of diabetes. And I think there's not a bigger overlooked facet of diabetes self-care than the area of mental health. So we are very fortunate to be joined here by professionals from our very own Center for Healthy Minds and Practice. Dr. David Cheshire, who's the director of the CHAMP Center, as well as Rosalind Graham, one of the therapists in the CHAMP Center, are going to be leading today's discussion on mental health. I just want to let everyone know that just like every session, we are recording this. So if you have to step away for a moment, you can find the recording on our webpage. And then at the very end of today's program, there's going to be a link to complete a very brief quiz. Now, the quiz really isn't meant to, this is not like an essay question type quiz. Really, we're just using this as a way to gather attendance figures. So there'll be a brief follow-up quiz at the very end. And you'll also notice on that quiz form, you'll put in your email address, and I'll be happy to share any information that's being shared via the PowerPoint slides or anything else. So just want to share that information. Welcome new members. Welcome back to those that were here last month. Again, I think this is going to be a good program. I'm really excited to learn a little bit more about protecting and preserving our mental health. So without further ado, Rosalind, I'll turn it all over to you.
Thank you. Thank you, John. Thank you for that. Let me just send a warm welcome to everyone this afternoon. Thank you for this opportunity to present this information to you. Today, we're just going to have a conversation. I have put together a really short presentation, a PowerPoint. And after presenting, I will open this up for questions. If you have questions, John will be just place them in the chat and John will help me moderate. I'm getting ready to share my screen if my presenter skills are working today. Can you hear me okay?
Yes.
Okay, perfect. Okay, today we're going to be talking a little bit about diabetes and mental health, as this series is about maintaining mental health in times of stress. And as John alluded to, we are team members here at the Center for Healthy Minds and Practice, CHAMP. What I'm going to suggest is if you have any questions anywhere throughout this presentation, if you'll just enter them in the chat and we'll get to them in the end. I have, for the record, this is my first time having a presentation here at UF Health since I began with the CHAMP program 4 months ago. I joined this team and I'm in really good company. Dr. David Cheshire, David, if you'd like to introduce yourself or say anything at this point, myself, colleague Donna, and Tammy Bellamy are all a part of the Center for Healthy Minds and Practice, just so that you know the team that will be talking and working with you today.
Yeah, just welcome everybody. I'm Dave Cheshire. I'm the director over here. I'm a psychologist. I worked in the trauma psych program for about a dozen years. And as I tip my cap over to Rosalind, who is an excellent addition to our program, we're lucky to have her. She comes out of the military and really, really strong in this area and also in just mental health as a whole. And I can tell you the one most enviable quality I'm sure that Rosalind's displaying right now is the first time you present at a new university is to have your boss sit in the audience. So bravo.
Thank you, Dr. Cheshire. Okay, we're going to talk a little bit today, and I have some learning objectives in mind. What I hope that we'll be able to look at is that diabetes, or having the diagnosis of diabetes, is not a laughing matter. And during this learning objective, there are 4 things that I want to kind of go over. I'm looking forward to helping people to identify mental health conditions that are often found in people with diabetes. We're going to talk a little bit about the connection between diabetes and mental health. And I'll also share some warning signs that you can look out to try to identify mental health conditions in people who have diabetes. And together we're going to talk about screening, treatment options, and therapy that are available. So let's begin at this part by just looking at someone who's recently been diagnosed with diabetes, and whether that's type 1 or type 2. The first thing that we notice is that there's been a huge change in your life. And so getting that diagnosis, whether as a child or a woman who's just pregnant and finding out that she has a diabetes diagnosis during the pregnancy, or at any point in time throughout the life, it is a huge change. The one thing in specific to this particular diagnosis for diabetes is that your life has changed, and it's impacting so many areas of your life. I put this cartoon character on here. She's Tina Belcher from Bob's Burger. This is the face that I make. Well, oftentimes this cartoon person, what's funny about her is that her facial expressions are very similar. So one face kind of shows nothing and the other one has a cracked smile. And similarly, the faces of a person who has diabetes and depression or other mental health conditions can be very similar and hard to detect. So I just kind of used that to segue into this presentation. So I guess you're wondering, how do we identify people who have mental health conditions? Because it can be difficult when someone has a diabetes diagnosis, because some of the things that they experience as frustration, whether that increases anxiety or worry and stress for them, that looks like anxiety, but it could just be due to, the bills that they're getting around their health care, and could look like and be what's called diabetes distress. Or the spiraling impact of this, which is spiraling up into that worry and anxiety, or spiraling down into what can look like a mental health condition of depression due to low sugar or their need for insulin. It can be hard to identify and recognize what's the diabetes and what part is a mental health condition. So I just spoke a little bit about how a person's low sugar or changes in their blood sugar can cause what's called diabetes distress. It's so similar with the symptoms: rapid mood changes, just low energy, or trouble thinking clearly. It's very hard to try to distinguish diabetes distress from type 1 and type 2 diabetes, because they have those similar characteristics and traits. But the specific way that you can tell the difference is that diabetes distress can be linked specifically back to their medical condition of diabetes, whereas a mental health connection kind of looks like other emotional disorders. We'll talk a little bit about that later. Specifically, I wanted to show you the research that talks about people having type 1 diabetes. Both type 1 and type 2 diabetes are at an increased risk for depression, anxiety, and eating disorders. But in particular, the research kind of speaks to bulimia as the common or most common disorder when it comes to a mental health condition in women, specifically because recently there was this term diabulimia. It's been coined to talk about how some people can manage their insulin intake for weight loss. And I'll define and explain bulimia a little bit later as a mental health condition. But also in type 2 diabetes, the research is showing that women with type 2 often show a more common eating disorder of binge eating. And binge eating is kind of self-explanatory in that it is just means that people are eating or having a large intake of food at one sitting or period of time and then feeling guilty about it later. And I'll give some clarity around that as we go. So again, diabetes distress versus a specific or a serious mental health condition is more around the connection of causation. So mental health conditions are more emotionally based or looking at the DSM-5 as criteria for recognizing them without that same medical condition cause. I speak specifically to disordered eating, which is kind of in the middle, in that disordered eating impacts 25% of the population. And disordered eating does not meet criteria for bulimia, anorexia, or binge eating. But the disordered eating kind of looks like this diagram on the PowerPoint, where it's on this continuum. You see healthy weight, yo-yo dieting, good body image in yellow. It's just a caution, things to watch out for. But as we go along, that chart turns into orange, whereas you see people, their preoccupation with their shape or weight, they're now using laxatives for abusive reasons to excrete out all of the food that they've been eating. They're compulsive about their overeating, calorie counting. And then on further down into the severity where it's red, and those are like real danger signs, where you get that distorted body image, and that's called dysmorphia. And in the dysmorphia stage, what they recognize about their own body doesn't match what someone else may see. And that can be a huge red flag in regards to anorexia. Anorexia is a condition where people are not eating, refusing to eat. And it's a very serious condition simply because it can cause death. Similar to bulimia, bulimia is more aligned with binge eating and feeling guilty about it, and then doing this behavior of purging. And purging can consist of self-induced vomiting, abusing laxatives, or extreme and severe exercise regimens. So there's a continuum where you just want to kind of look at the signs or symptoms that you might identify, because food eating disorders or disordered eating can be a problem if not watched out in and seeing the danger signs that people may exhibit. So one of the questions in the learning objective that I want to really highlight is what the physical signs will look like. These physical signs in no way are complete in that these signs are just some typical things that people with diabetes you may notice within them, but taken alone, they're just regular things to watch out for. They're not severe or warning health risk, but together with some of the emotional signs that I'll talk about later, do signify that maybe we need to be looking more seriously and deeply into some other options. So physical signs could be fluctuations in weight. There's a change in their bowel habits because visiting the restroom a lot due to abusing laxatives. For women, they have irregular periods, sometimes missing periods due to low body weight, and that's mostly seen in people who have a tendency to go toward anorexia. And feeling dizzy, weak, or tired and fainting can be some, I guess, lower risk type symptoms, but taking again in connection with the other physical signs of stomach complaints or noticing changes like deterioration in their skin or hair problems, loss of hair, are incredible notices of, hey, there might be a problem here. One thing that dentists report is that they're seeing this acid dental problems, cavities and problems with the dental visits in people who are practicing disordered eating behavior. So those are some of the physical signs that can be recognized. But on to the emotional signs. It can include preoccupation, mostly not like obsessive compulsive disorder, but there is a preoccupation with just food, dieting, measuring their calorie intake, carbohydrates, which are all a part of managing diabetes. So though, again, it can look similar to that cartoon. You don't know which facial expression is significantly different. But if in conjunction with the preoccupation with their body image, you're hearing negative talk, self-talk, or they're telling you about a particular body part that they complain about or they don't like, if they're constantly discussing their weight, getting on the scale or needing to do it and being obsessive about weighing themselves. Those are cautions. Limiting and restricting whole food categories, like only eating peanut butter or like picking specific foods that they feel are safe to eat. Those are really high health risk and warning signs because there are a whole spectrum of healthy foods that can be helpful to someone, and they need the nutrition in order to maintain and manage their diabetes. But in conjunction with them doing those other practice or having those other emotional signs, it's a red flag. So food rituals, kind of on the bottom and maybe a more severe type thing, can be seen as innocent and not a huge red flag, but specific food rituals look like cutting their food into very small increments, separating their food on their plate, having specific eating times, or again, eating only specific foods. One thing I noticed in my clinical experience is that my observations of clients who have eating disorders, they chew very, very small amounts of food, very slowly. And if you pay attention to those types of signs, those could be the warning signs that, hey, there might be more to this that needs investigation. One red flag, eating disordered or disordered eating, people often withdraw from eating out or being observed while there's like meeting them for lunch or breakfast. They don't like to attend public eating occasions. They usually isolate and eat alone. So those are the physical and emotional signs that someone with diabetes, if you want to kind of recognize, or even within yourself, if you notice these things becoming an issue, to pay attention and maybe do a little bit further investigating. So as we segue into the learning objective about what you can do about it, or what are some things to help us identify it, mental health screening is one of the first things that come to mind. Taking a mental health test. Research shows that most primary care physicians, when they are working with clients that come in, they want to see your physical conditions, listen to your self-report. And there's not always a mental health professional in the office or at that location for outpatient care, but there are online screening tools available that I want to suggest and offer as a possible way of assessing, hey, is there more going on with myself or someone that I care about that I've identified those other warning signs on. So taking a mental health screening, whether online, you can just Google mental health screenings. There's a whole lot of different sources that you can utilize. But also when you do go to an appointment, take advantage of speaking with your primary care physician or whatever doctor that you attend, that hey, I've noticed that I'm doing this behavior or some other signs, and I want to talk about it with someone. One of the key takeaways is that a lot of people who with diabetes don't notice or are not making the connection between diabetes and their mental health conditions. So mental health screening could be useful in identifying that. And one of the main ways of coping or things that you can do if you are identifying those danger warning signs is to, and even if you're not, is to look into managing stress. We all talk about that during this pandemic, during just regular work, load, that managing your level of stress and what that looks like in your life, ways to do that is a huge part of just being healthy and having a work life balance issue, addressing that. But I have 6 stress busters that I usually kind of focus on and pay attention to. And that is having a healthy or positive attitude and being intentional about that. That would be one. Being as kind to yourself as you are to others. Oftentimes, care providers or healthcare workers often find themselves caring more about the other and less prioritizing of the self. The third stress buster comes from the big book of AA, and it talks about the serenity prayer, accept what you can't change, which is a great one because if you recognize what your limitations are and focus on those things that are within your control, letting go of the things that are beyond your control, it can alleviate the stress around those concerns. If you're not able to if you're not able to let go of that stress or that concern that's not within your control, you may find it helpful to talk to someone, and whether that be a friend, a family member, or a priest, a counselor. Number 5 of the stress busters would be to tap into exercise, get physical, be active, make time in your day to spend 20 or 30 minutes getting out into the sun or taking a walk or whatever form of exercise that you may like. And the last or 6th stress buster would be just taking time to unwind. I find that people do not like to hear that one or have a leisure time built into their self-care or stress management regimens. And that would be the last one that I'd encourage. On to this next slide, I want to invite Dr. Cheshire to speak to treatment therapies and ways and options that people with diabetes can manage their stress and manage diabetes from the things we've talked about.
Thanks, Rosalind. One of the things that this or any chronic health condition that people often face is, it's hard when the enemy is inside our own skin. It's when our bodies are rebelling against kind of our overall well-being. And that can lead to all kinds of different feelings, from embarrassment, shame, to frustration, depression, as Rosalind's been talking about, things like that. This is why it's so important to be connected to other people, and having, especially in something like diabetes, especially for people who are newly diagnosed, having a mentor, somebody who has lived with the diagnosis for a while and can kind of talk about, like, your life doesn't have to be completely disrupted. This doesn't have to be the end of everything. It can be the beginning of something new. Things may change, but that's not necessarily for the worse. Along with that, family, friends, clergy, other professionals in the area, having someone to reach out to. The very first thing that Ross has put on the slide under diabetes management is reduce stress. And stress in and of itself is not a particularly problematic variable. We need a little bit of stress to do things. Another word for stress is motivation, right? But when that stress becomes crippling and gets in the way of being able to do the things we need to do in our life, so that we're not able to sleep, we're not eating appropriately, we're not able to relax, unwind, impairing our interpersonal relationships, then we really need to kind of focus on it and reduce the overall stress level. And as Rosalind already had in the last slide about kind of reducing that, focusing on well-being, you may tap into exercise to do that, having someone to talk with about that, but really engaging in hobbies, extracurricular activities, making time for the things that are important. Life, you really need to tap into the joy of life. And so many of us, especially in the last year, have been so crippled with anxiety, so crippled with stress, and we've lost those natural outlets that we've had in our life in order to enjoy things like going out with friends, like engaging with families, like going to restaurants or going out shopping or whatever it is that's your brand of tea. All of that's been disrupted. It's been hard to find new things to reduce that stress in. And then we forget about it. Kind of the COVID year of 2020 is kind of turned into a habit for a lot of us. And we're going to have to unlearn some of the bad habits that we learned last year when the world starts to open up again for us. And part of that can be scheduling time, actually putting it on your schedule, the way you put meetings on your schedule. This is going to be my block of time to watch something on Netflix. This is going to be my block of time to read a book. This is going to be my block of time to meditate. This is going to be my block of time to pray. This is going to be my block of time to talk to mom on the phone. It's going to be something, but we really need to schedule that so that it's important and also that we can commit to it. If things get overwhelming and you don't feel like you can connect to family and friends, or there's nobody in your life that really seems to be getting it, it may be worth reaching out to somebody like Rosalind, somebody like me, somebody like Donna, to talk to a professional and talk about, look, these are the things that are bothering me. And maybe you just need a place to vent that out and have a safe place to share. Maybe you'd like to work on some skills to relax and to focus on well-being, like progressive relaxation or other cognitive exercises. A very, very powerful part of this, as the next bullet point says, is therapy groups. Being with other people that are going through this. Now, maybe those people have diabetes, maybe they do not. But if you can talk to other people that are going through stressful situations in their lives and learning what they're doing, maybe some of what they do you can wear as well, and it'll work for you. Maybe not. Everyone's individual, but there's no need to reinvent the wheel here, and we can learn from each other's experience and wisdom. And lastly, medication management. One of the neat things about diabetes particularly is all of a sudden we have all these technologies available so that we don't necessarily need to do as many different needle pricks as we used to do to test blood sugar. I understand now there's an app on your phone that you can just put your thumb on the screen and it can measure your blood sugar level. That's pretty awesome, right? But at the same time, some people are insulin dependent. There's really, as far as I know, and there's other people on the phone call that will be more experts in this, but there's really only one way to get insulin into your system. And so having that as kind of a disruption of your routine can be troublesome and frustrating, and learning how to incorporate medication management into your life is important, because so often having the appropriate medication, having the appropriate dosages really lends itself well to positive well-being and mental health. And we have down here at the very bottom, different types of therapy. Every therapist is different. Rosalind and I are both therapists, and you can see looking at your skin, we have some remarkable differences. I'm taller than Rosalind. But basically, when people seek out a therapist, the single most important part of therapy is that you have the ability to make a strong relationship with that therapist. So you can trust them, that you can talk to them and you can feel like they really get you and are listening to you. Neither Rosalind nor I can work with everybody, just because some people are going to feel more comfortable with another therapist than they are with us. And that's okay. When you're shopping for a therapist, when you're shopping for a behavioral interventionist, it's so important that you're with somebody you can trust. And that may be that you want them to be male or female. You want them to be a person of color, Caucasian. You want them to have certain life experiences that match your own. All of those things are okay when it comes to who you feel comfortable sharing some of your most intimate parts of your life with. Different therapists practice different styles of therapy. Cognitive behavioral therapy is going to be really looking at what's going on inside your head in terms of looking at maybe some irrational beliefs you might have about what it means to have diabetes. Do you constantly drag yourself down inside your head, negative self-talk and things like that, and maybe replacing that with more positive perspectives. Family therapy, of course, will be taking more of a systems look at like the different people in your life that are important, and how your interactions with them influence how you feel about yourself and how you behave. And then that last one, dialectical behavior therapy, and honestly, I know least about this one, but similar to cognitive behavior therapy, but it puts a lot of emotion focus in there as well. So what we really want to do is make sure that, one, you can bond with your therapist and understand that they get you and you feel comfortable with them, but also that the style of therapy that they're bringing to the table is a style that you're looking for. One of the very first things I ask clients when they come in is, what are you hoping to get out of therapy, and what would you benefit most from? Do you want me to be directive? Do you want me to just sit here and not talk and listen and give you a chance to really emotionally vomit? And it's so important that we match you. And if you go to a therapist that doesn't get that, it may not be the right therapist for you. All right, Rosalind, let me kick it back to you.
Thank you, Dave, for that. The summary, you'll all get we're short on time now. So I just to summarize what the learning objectives were. And I had this little meme of fighting diabetes while maintaining a successful career and happy life is like a bear riding a shark. It's a huge challenge, but the Center for Healthy Minds in Practice, we want to be a resource for you. We thank you for the opportunity today to present this information. We're going to save a little time for questions, and I'm going to give it back to Jonathan so that he can do that or have other announcements. Jonathan, thank you for this opportunity.
Hey, all right, thank you. I do appreciate your time and dedication to this cause. I did have a couple of questions that might be helpful just for the rest of the folks on. Do people need a referral in order to talk to anyone from the CHAMP Center?
Dave, would you like to take that one? I'd like to just say no.
That's the short answer is we work with anybody. You do not need a referral, and it's free and it's confidential. You can contact us in the number on your screen there at 8332. You can also send us an email at champ@jaxcfl.edu. What we try to do is offer same day, next day appointments. If you have a strict schedule you're following, we need to schedule it out a little bit further, like a week. But we are available to anyone, and most of the people that come to us are self-referred. Thank you for the question, John.
Yeah, no problem. And I did put a link to the post test again to fill that out just to get credit for attendance. And then you put your email address, and I'll share with you the slides too. Another question that's come into me, and I think it would be helpful to know. So there's quite a few folks on this call and in this program that are in Gainesville. Are there similar resources to CHAMP in Gainesville?
I'm guessing I'm taking that one too, Rosalind. Let's see.
Yes, please.
Okay. Short answer is Gainesville does not have a CHAMP program, but they do have employee counseling and student counseling on campus. I'm not as familiar with Gainesville, but Gainesville and Jacksonville both have the same employee assistance program that we're using. And so employee assistance is available to anybody. It will offer up to 6 free mental health sessions with a local counselor. And that won't be on campus, and it may or may not be somebody at a PhD level or a master's level. It's just hard to figure who you're going to get. But you will be paired up. It's 6 sessions. It's free. It's 6 sessions per issue, if you will. So if you were feeling depressed today and you called, they'd set you up with 6 sessions, and say in October you were having a hard time with anxiety, you'd get another 6 sessions for that particular problem too. And that's also available to families. CHAMP only works with employees, whereas EAP will provide their services to any family member in the employee's family.
Well, I'd like to do a quick shameless plug and just say that for the CHAMP program, our sessions, like Dave mentioned, are unlimited and they're free. We don't participate in Epic and keeping records and keeping things confidential. And we offer virtual sessions so that if someone resides in Jacksonville but wants to make an appointment with us, just like we're in this learning experience and having this conversation today, we have virtual capabilities for wherever they're located.
Yeah, thank you. And then also for those of you that are seeing or maybe not seeing in the chat, Tammy also shared the main number for the EAP provider, which is 844-216-8397. And one of the questions I had for you, and you mentioned it a couple of slides ago, Rosalind, about online screening for mental health. Are there any that come to mind? Because, you know, I know a lot of times when you Google something, you don't know where the heck you might end up, especially for something
I'm so happy.
a screening tool.
I'm really happy to answer that question. Well, there are. My sources that I used came off the Mental Health America, and they actually have a mental health screening link on their site that I got some information. But on most of the diabetes professional organizations or just member organizations, local resources, even within the Diabetes University, there are links to these organizations, and usually on them, they're recognizing this need for mental health and diabetes to go together. And there are mental health screening types of links within those different organizations that are available. The one that comes to mind most first or primary is Mental Health America, and utilizing that.
Because I think for me, and again, if anyone else has questions, you can, I think I can unmute, or you can unmute yourself or type it in the chat. So, I've been dealing myself with diabetes for over 30 years, being diagnosed at a young age. And the first part of my like diabetes stress was really more of a stress of just worry. You worry about everything. How's this going to impact? Can I eat this? Can I do this? Can I take this? But now it gets to a point where it's more of a stress from just all these different tasks that you have to do with monitoring blood sugar, taking medicine, getting prescriptions refilled, following up with lab work. And Dr. Chesai, you mentioned some symptoms to be on the lookout for, but are there other underlying symptoms that that somebody with diabetes might need to be aware of that say, hey, that some of these frustrations that you're experiencing are getting a little bit untenable? You mentioned sleeplessness and things like that, but are there other lesser known symptoms that might indicate you might need to talk to somebody?
I'm going to answer. Thank you, John. It's a great question, and I'm going to answer it very generically because the short answer is yes. So next question. No, the generic answer is if you are suffering in any way, either physically or from a mental health perspective, and it's interfering with some aspect of your life, whether that's academic or occupational or interpersonal. So you're finding yourself having a hard time unwinding and you're getting into nitpicky fights with your partner or a member of your family. Or if you're just not feeling right and you don't feel like you're enjoying life, anytime that something is interfering with your ability to be well, it may be time to reach out, especially if it's ongoing. So we all have off days. We have a bad day. That doesn't mean there's a mental health condition. But if those bad days are outnumbering the good days and you string a few of them in a row and all of a sudden you realize, well, in the last week, I have cried every day and I don't know why, it's probably time to reach out to one of us. And something else I'll put on top of that, I can't speak for Rosalind with this again because all mental health therapists are different, but I don't treat depression, I treat suffering. And so I'm not really all that interested in the diagnosis. We're not a billing service, so I don't need that as a billing code for insurance. So if you're feeling sad and you just need to reach out and talk to somebody, or you're feeling unwell, or you just feel like you need to unburden yourself, that's really the time to reach out to us. It doesn't have to be full-blown depression to want to go out and just not feel quite so bad.
Okay, thank you.
And that's I concur totally with you, Dave. And I always say, what is it? An ounce of prevention is worth a pound of cure. You don't have to wait until there is a problem or there is a concern, John. I would say before that and have the tools already so that if something comes up later on, you're even that much better prepared. Does that make sense?
Oh yeah, yeah. And I think it's just important for a lot of people to hear that because it's, what we tell people in our, last year and years prior, we would have a pretty intensive diabetes self-management class program. And you basically just tell people, look, diabetes is a full-time job that you can never quit, and it's important to understand that, but to not overlook the fact that just because you can't quit it and you're experiencing stress about it doesn't mean you can't do anything about it. And it's very natural to want to talk to your doctor about your blood sugar, your blood pressure, your cholesterol, but maybe not as natural to say, hey, you know what else, doc? I don't feel too good. I feel just kind of overwhelmed by things. And I just want people to be aware that there are so many resources to get help for that area because it does seem to kind of not get the attention I feel it deserves as far as helping, get more attention to mental health. So I do thank you guys once again for helping us in this new venture. I know we're running short on time. I did want to share one other link that I just put into the chat, but this is on the Gator Care website. So no matter where you are, whether you're in Jacksonville or in Gainesville, you can go to gatorcare.org. and you can find their diabetes resource page. Now, so there's some helpful links in there, but I just want to draw your attention to their new agreement with Contour blood glucose meters. So there is a no cost, no co-payment test strip program that they have. So again, for those of you that are having to check your blood sugar by using this particular meter and going through, there's one little learning module that Gainesville wants you to watch. But once you do that, you're eligible for this program. So that'll at least minimize some of the financial burden that can go into blood glucose monitoring. So I did put it in the chat if you want to follow that link. If for some reason you're not able to access the information that's in the chat right now and you're like, hey, I didn't get a chance to find that quiz, you can send me an email if you got the invite to this session. You also have my email address. I'd be happy to forward that to you as well. So I do want to thank everyone. Thanks again to the Champ Center for helping us out with this venture. Next month, we will be talking a little bit more about one of the areas that was discussed today, and that is medication management. So we are fortunate to be joined by Rachel Carloni. Some of you may have met in some of our previous classes. She's going to be talking about some of the new breakthroughs in diabetes medication, as well as field any questions about some of the side effects of diabetes medicines and what types of insulin are available or what types of other oral agents are available. So it's a real good update on the world of medicine as it relates to diabetes care. So with that, everybody be safe out there. I appreciate you for tuning in. Thank you again to the Champ Center, and look forward to seeing you next month. So have a good day. Bye, everybody.